So we're doing infertility clerking today, okay? Infertility is actually a very high yield topic, all right? So it's something that we should all know very well. Infertility clerking. Dr. Izzy, where are you? Right.
I'm here.
Okay. So first, you know the scheme of the clerking. You introduce yourself, you greet the examiner, you greet, you introduce yourself or you obtain consent, you establish rapport. Then the next thing is you start with your biodata. For clerking, you remember. Then after the biodata, you want to ask about the reproductive profile. So for the biodata, you know what to ask. You want to ask about the patient name. You want to ask about the patient age. You want to ask about the occupation of the patient, right? You want to ask about, please tell me, I want to hear from you, doctors.
Yes, doctor.
After occupation, what's the next thing? You should know this. You want to ask about the occupation. After occupation, what's the next thing, doctor? You want to ask about the address of the patient. Where does the patient live? Okay? You want to ask about the tribe. You understand? You want to ask about the religion or religion before tribe. Anyone? The religion of the patient. Then you want to ask about the tribe of the patient. Is he a Yoruba person? Is he an Hausa person? You want to ask about the marital status. Marital status. And you want to ask about the level of education. Okay? Then after level of education, then you want to ask about the reproductive profile. So for reproductive profile, you know what to ask. The first thing you want to know the parity. You want to ask about the parity, the gravidity. You want to know about the gravidity also. Gravidity. You also want to know about the LMP. You understand? And maybe the last confinement. You understand? So these are the basic things you should know. If the person has been, how many children the person have, if the person is pregnant, the expected days of delivery. You understand? And the exact gestational age you want to know. And you want to know the last time the person saw the menstrual period. These are the basic things you want to know under reproductive profile. So for infertility, what will be the presenting complaint, doctor? What do you think will be the presenting complaint? Welcome, Dr. Aisha. What do you think will be the presenting complaint for somebody who is infertile, who came to the clinic for infertility? Anybody want to tell me the presenting complaint for infertility? Doctor, you are free to use the chat box if you don't want to talk. And if you want to talk, you can say something. What will be the presenting complaint? Doctors, are you all with me? Failure to conceive, okay? Failure to conceive, okay? So the person will come with failure to conceive, inability to give birth. Hold on a second. Hold on a second. Yeah, inability to conceive. Maybe inability to conceive. That's called infertility. Okay, so the person is coming to you for inability to conceive. So that will be your presenting complaint. So you have to analyze the symptoms. You have to clerk the symptoms. Do you understand? So inability to conceive. So first, even before explaining or before clerking for infertility, what is actually infertility? Anybody want to give us definition of infertility? It's very important to know the definition. In Nigeria, they love definition. What is definition for infertility?
It is failure of a couple of reproductive age.
Failure of the couple of reproductive age. I'm listening.
Yes, to conceive for a duration of 1 year with frequent penile-vaginal sexual intercourse.
Penile-vaginal sexual intercourse. Apparently, you're correct. You're correct. But there are so many definitions, and different people have their own. What's it called? Hold on. I'm sorry, doctor, for the distraction. Somebody is trying to call me also. Okay, so there are so many people with different definitions of infertility. Okay, and Nigeria, each doctors like they prefer some particular definition to the other. So for infertility, you are correct. It's inability of couple. You have to realize that, and this couple have to be couple of reproductive age. Is not somebody who is not of reproductive age. Is inability of couple of reproductive age to achieve pregnancy after 12 months of regular, adequate, unprotected sexual intercourse. And it must be ejaculatory sexual intercourse. Do you understand? So what I mean by adequate or unregular, so it must be having sexual intercourse greater than or less than 3 times on different days a week. Do you understand? Some people we have, probably they have sexual intercourse, let's say, for example, twice or maybe 3 times in a week, but they have it the same day. That is not adequate. It must be on 3 different days. That is when you say it is adequate. So these are some of the things you have to take note very well, because once you are clerking this patient, it's very important for you to ask some questions. Am I making sense, doctor? So our presenting complaint is inability to what? Inability to conceive, right? Or inability to achieve pregnancy. Inability to achieve pregnancy. Am I correct? So you want to clerk, you want to analyze the symptoms. So let's start with our symptoms analysis. So symptoms analysis. So doctor, first there are some basic questions you want to ask this patient. There are some basic questions you want to know, you want to ask about this patient who has been trying to achieve who has been trying to give birth, who have been trying to achieve pregnancy. So what are the basic questions you need to ask? First is the onset and the duration. You want to know, you remember I told you about doctor. You want to know how long have you been trying to conceive? It's very important. That should be your number 1 question. Okay? You want to ask how long how long have you been trying to conceive? Question mark. It's very important to ask that one. Okay? So how long have you been trying to conceive? It's very important. Okay, so after knowing, am I correct with that spelling? Is it conceive? Is it I before the E or E before the I? And doctors? Hello, please, can you unmute your audio, everybody, please? Why is, I'm not hearing a feedback from no one. Dr. Eze, what is going on? Hello, doctor. Oh, wow. This is somehow, if I don't get a feedback, it's really somehow, doctor. It's not really encouraging. I want to get a feedback from you. I'm talking, nobody is actually giving a feedback. Hey, doctor.
Sorry, what was your question, doctor?
Oh, doctor, you're not paying attention, Dr. Aisha.
It's EI, you're right.
Okay. So apart from that, please let's pay attention, please. Let's follow what you're saying. I don't just want to do this and we just get a video. I really want us to pay attention. It's very important, please. And it's a very high yield stuff that you need to know. So I'm analyzing the inability to achieve pregnancy. Do you understand? So the first thing is you want to ask how long has the patient been trying to conceive? Is one of the questions you want to know. And apart from that also, what question do you think is very important again? Apart from this, let's do it together. Somebody who have been trying to conceive. Doctor?
Frequency of intercourse.
Frequency of intercourse, you're correct. It's very important. Frequency of intercourse. Okay. So even before the frequency, you want to know if this person is staying with the partner. Do you understand? You know, some people that their husband, maybe a civil engineer, their husband travel far away and they are unable to have coitus. So it's also one of the causes of infertility. You understand? So you want to know, do you live with your partner? Do you live with your partner? You want to know that. Okay? So apart from that, what other things do you want to know, doctor? The frequency of coitus, as Dr. Aisha said. Okay? You want to ask how many times, how often do you have sexual intercourse? Okay? How often do you have sexual intercourse? Okay? Sexual intercourse. So after, how often do you have sexual intercourse? What other thing do you want to know? Remember in the definition I gave to you. You remember the definition? You know, in this world that we live in now, there are different orientation, different sexual orientation. Some people might be having anal sex and they might thought they are going to give birth by having anal sex. No, people can achieve, you can't conceive with having anal sex. So you want to be sure about the sexual orientation. So you want to ask, do you have vagina penetrative sexual intercourse? You want to ask the patient, do you have vagina penetrative sexual intercourse? Okay. So after that, the other thing you have to ask, doctor, are you all with me? Please, it's like you're not all with me. It's really
Yes,
not.
we are here.
Yeah, please let me
Yes,
get the
yes,
feedback. Let's someone.
Yes, we are here.
we are here.
Okay, thank you. So you want to know if the patient have vaginal penetrative sexual intercourse. Okay. And apart from that,
Okay.
also, you also want to ask other questions. What other question do you want to ask, Dr. Tolu?
Has the husband fathered any child before?
Exactly. You want to know if the husband or father a child before. That's very good. You're correct. Even from the definition I gave to you, don't forget it has to be unprotected sexual intercourse and the frequency. So you have to ask the patient, do you have unprotected sexual intercourse? People can be using contraception and they expect themselves to get pregnant. No, this might seem ridiculous, but trust me, not everybody is educated up to that level. So you have to ask. Do you understand? So you have to ask, do you have unprotected sexual intercourse? So Dr. Aisha talk about the frequency and the frequency. You want to know about the frequency of sexual intercourse. So what did you say the other time, doctor? You said something also. What was it that you said?
She said if he
About
has
the
fathered any other pregnancy.
Okay, yeah, very important. You want to ask, have your husband fathered a child before now? You want to ask, or the woman itself, you also want to confirm, have you had a child before now? Both of them, because there are different causes of infertility. There's male causes of infertilities and there's female causes of infertility. So you want to rule both of them out. Don't forget. And apart from that also, you have to be sure about the husband. You know, I told you it has to be an ejaculatory sexual intercourse. So you want to ask, does your partner ejaculate or release inside your vagina after sex? Do you understand, doctor?
yes.
Yes.
Husband or your partner, let's use the word partner. Does your partner ejaculate or release? In Nigerian, people use the word release a lot. Release inside your vagina after sex. So we want to ask also. What other question do you want to ask? Doctor?
Any history of abortion?
Do they smoke? Do
Any
they drink
history?
alcohol?
Okay. Okay. Apart from that, there are more questions. You have to ask the woman, does they douche? You know, there's these practices that people does after postcoital practices. Like after sexual intercourse, they went and washed themselves vigorously. You know, women practice those things. Yeah, some people even wash their private part with alum. You know what it's called alum? You know alum now,
Yes.
doctor. Yeah, they wash it.
Yeah.
They you know the thing they use in washing snail. So they feel like there will be contraction and everything will be intact the way they have before. So they go, they wash it vigorously. So those are sexual practices. So post coital practices. So you want to ask, do you douche after sex? Do you wash vigorously? Do you like douche after sex? You want to ask the woman. This thing, it looks as if it's not real. But trust me, doctor, this thing is very real. People do all these things. I'm not lying. Yeah, people do all these things. Hold on, let me try and okay, let's continue here. What other question do you want to ask? There are still more questions. Apart from that, you want to ask the kind of family. Is it a polygamous family or monogamous family? Because in a polygamous family, maybe the man is not satisfying the woman enough. Maybe during the time the woman is ovulating, the man does not even move close to the woman. Do you understand? So you want to actually know the kind of family. Is it a polygamous family or a monogamous family? So are you in a polygamous or monogamous family? You want to be sure. It's a very important question you ask. So what other thing do you want to ask, doctor? What other thing? So in summary, this is enough. There are still a lot of questions. There are still a lot of causes of infertility. You understand? There are other causes of infertility. So in summary, this is enough for you to analyze the symptoms. This is enough. Then you want to go to the history of causes. You've analyzed the symptoms. That is enough. Okay? The woman has been trying to achieve conversion. 10 is enough. Okay? So let's move to the next point. Let's talk about the history of the causes. So for the causes of infertility, there are so many causes of infertility. I believe everybody is with me, please. Doctor?
Yes, yes.
All right. It's only Dr. Gift that is with me right now. And I don't know, this topic is actually a very important topic. And I don't know why doctors are not here with us today. This is very, very high topic. Very, very high. It's something we should all know very well. It can come out in Mdcn exam, the next exam, April exam. So, yeah. So let's continue. So you want to ask about history of causes. History of causes. So what are the causes of infertility? So let's start with the female causes first. So there's female causes of infertility, and there's male causes of infertility. Female causes or female factors. Let's use the word female factors. So what are the female factors of infertility? Let's do this together. What are the female factors of infertility? And doctor, please, unmute all your audios. I want to be hearing from everybody. Or you send me a text. Please, everybody should unmute their audios. All doctors should unmute their audios.
Ovulatory.
Ovulatory, what do you mean ovulatory, doctor? I want to understand. I mean female causes of infertility. Female causes of infertility. Dr. Tolu, Dr. Aisha, Dr. Gist.
Ovarian causes. Like
Ovarian
PCO.
causes like PCO, okay? PCOS, okay? Polycystic ovarian disease could be a cause. So it's very important, even after knowing the name, you should know how to ask the question, how to direct your question. For example, for PCO, there's a way you ask your question. So how do you want to ask the question? You can ask any abnormal hair distribution associated with maybe voice deepening for polycystic ovarian syndrome. Okay? Doctor, please, are you all with me?
Yeah.
It's like everybody is not, like doctors are not here with me. I don't know.
We are with you.
Is Dr. Tolu here with us? It's like Dr. Tolu is not here.
Yeah, I'm here. It's because I'm driving and I don't want the sound. Like I don't want.
All right.
Sorry.
Okay. So you want to ask any abnormal 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 distribution, comma, associated with voice deepening. Voice deepening. Okay? It's very important. Okay? You want to ask about any changes in the voice. Okay? So it's very important for you to ask something like that. So after asking something like this, then the next thing you want to ask, what other causes, please? Apart from polycystic ovarian disease, what other causes, doctor?
Premature ovarian failure.
Premature ovarian failure, okay. It's still under ovarian this thing. So what other thing? Please let's mention some other things again. Apart from premature ovarian failure. You said?
Menstrual cycle.
Endometriosis.
Endometriosis, of course. Endometriosis is one IG thing you have to mention. Very important. Thank you so much, Dr. Tolu. Endometriosis. So how do you want to ask endometriosis? Endometriosis, right? So I do want to ask endometriosis. There's two things. There's endometritis and there's endometriosis. Both of them can actually causes, what's it called? Both of them can cause infertility. Both of them can cause. So how do you want to ask a patient about endometriosis? You know, they won't understand what is endometriosis, but you have to say it in a language they will understand. Okay, doctor?
You have to ask.
Chronic pelvic pain.
Chronic pelvic pain. Okay, you're correct. Is there any other way?
Cyclical.
Okay.
So is it dysmenorrhea?
Yeah, you can ask like this, like, do you have any lower abdominal pain associated with large chocolate discharge? You know, endometriosis, you have all the chocolate discharge. Like, do you understand? So you can ask, do you have any lower abdominal pain associated with large chocolate discharge? You understand? That is enough. Any lower abdominal pain associated with large chocolate discharge. What other thing, doctor, please, apart from endometriosis? Also endometritis also. I said it. Endometritis. So you can ask endometritis also. Endometritis. So for endometritis, how do you want to ask the question? You want to ask about fever and lower abdominal pain. You know, it's this thing. So mostly it should be fever. Any fever with lower abdominal pain. You want to ask about endometritis. So what other causes of infertility, doctor? There are some major causes that I'm expecting us to see. Fibroid, thank you. Fibroid is a very, very important cause, especially in Nigeria. A lot of people are having fibroid, okay? So how do you want to ask question on fibroid? How do you want to ask question on fibroid, uterine fibroid?
Lower abdominal pain, bladder fullness.
Heavy menstrual bleeding.
Heavy menstrual bleeding. So you have to put it together. You can't be asking all those symptoms of fibroid. You are not cancelling or clerking fibroid. So here you have to ask specific thing. You can ask lower abdominal pain with heavy menstruation is enough for fibroid. They will know you are actually talking about fibroid. Do you understand? So lower abdominal pain with heavy menstruation, right? Menstruation. That's enough. Okay. So apart from this, what other causes? Doctor, I want to hear from us. There are a lot of causes of infertility in female. There are a lot, even in male. We are still talking about female causes. So there are a lot of causes of infertility. What other causes, please?
PID.
PID. Thank you. PID. Okay, I'm going to write that now. PID, you are correct, doctor. PID could actually cause it also. You know what is PID? We all know what is PID. And doctors? PID.
Yes, we all know.
You have to be sure because in Nigeria, people use a lot of acronyms, a lot. Do you understand?
Pelvic inflammatory disease.
Pelvic inflammatory disease. So pelvic inflammatory disease could be one of the major causes of infertility. Okay, so How do you want to ask pelvic inflammatory disease? How do you want to ask the patient? You can ask any history of infection, any previous history of infection, or maybe have you been treated for any infection before? You can ask it like that. Any infection, any toilet infection, or anything before. You understand? So what other causes? What other causes, doctor? There are other causes. What about what's it called? Contraceptives. Contraceptives. You know, people take OCPs. OCPs, combined contraceptive, or OCP, and oral contraceptive pills. All those contraception in general, contraceptive uses. So let me just say contraceptive uses. Contraceptives uses. So contraceptive use can actually cause infertility. So if you are going to use contraceptive, be sure and be careful of the contraceptive you use. And even when you are using it, you have to know when to stop using it. And they are the one that is best for underage people, like, I mean, people who are just, you that you are not like married, there are special contraceptive for you. You that you are married, you are probably in school or something. So don't let us talk about that. Just let's continue, doctors. All right. So apart from OCPs, what other things again? And doctor, there are a lot of things.
Prolactinomas.
Prolactinoma. Thank you. Prolactinoma. So how do you ask about prolactinoma? This is very tricky, doctor. How do you want to ask the patient about prolactinoma? Any idea, doctor?
From galactorrhea.
Yes, you want to ask about breast discharge. Any breast discharge? You want to ask the patient. Maybe the patient is having any breast discharge. You understand, doctor? Please, are you making a screenshot of this thing that I'm doing? You can make a screenshot so I don't clear it once. You understand? If you want to make a screenshot of it, because later some doctor will demand for screenshot. So you can make a screenshot of it now before we still continue. Okay? So apart from prolactinoma, what other causes? What other causes? What about this, what's it called? This Turner syndrome. Even stress. You have to ask the patient about stress. Stress is one of those causes of infertility. You understand? And apart from that, there are other causes. What other causes are those? Those drugs also. Or history of UTIs. History of UTIs. Or STIs.
Dr. Bob.
Yes, sir. Yeah, yes, ma'am.
How do you ask for Turner syndrome, please?
Because Turner syndrome, yeah, you can just ask about the shape of the person, the posture of the person. You understand? You can ask, okay. Can you describe, even when you see the person, you will know. You understand?
No, exactly, that's my point. Yeah. So how do you
only if you are asking in respect to the husband.
Okay.
Yeah, in respect to the husband. That one, maybe you are asking for Klinefelter syndrome. So you ask, is your husband tall and does he have a, what's it called? Like
gynecomastia.
Yeah, gynecomastia, like breast, something like that. Yeah. You understand? So that is how you ask for those ones. You understand, doctors? Yes, so can we continue? Can we continue?
Yes.
Yeah.
All right. Yes. So let's continue, doc. Hold on. What's going on? Hold on, please, doctor. I'm sorry. Sorry, doctor. Yeah, let's continue, doctor. Sorry, let's continue. So after asking about so we asked about UTIs. What other thing do you want to ask again? What about exposure to radiation? It's also one thing. Exposure to radiation, radiotherapy. You understand? Radiation exposure. When the patient exposes himself to radiation, it could cause infertility also. So I think this is enough for female factors. Are you getting what I'm saying? There are a lot of causes. There are a lot of causes. But this is enough. Even advanced age. Don't forget, advanced age is very important. Advanced age. Mostly, the most gynecological problem always start from age greater than 35. From 35 years and above, the woman is always prone to a lot of gynecological problems. talk of microsomal baby, talk of placenta abruptio, placenta previa, a lot of things, and gestational diabetes mellitus. So just remember, once you're asked about risk factor to some of these things, it is advanced maternal age. So it's one of those risk factors to having infertility. You understand? Advanced age. Am I making a point, doctor? This is enough for us for now. This is enough. There are other causes, even drugs. There are drugs. There's its particular drug. Is it diacetylbestrol also? It's one of those drugs. They don't really use it again. It's one of those drugs that also causes infertility. So please, can I clear all these things up, doctors? I will clear some of it because we need to also write other causes also. So let me remove this one. Right, doctor? Are you all with me?
Yeah.
Yes.
Wait. All right. So let me clear some of these things off. So let's talk about the. We've talked about the female factor now. Let's talk about the male factors. The male factors. What are the male factors that can cause infertility, doctors? Let me hear from you. What are the male factors that can?
Trauma.
Trauma. Okay. Okay. Trauma to where?
To the testes.
Okay. Okay. Okay, you're correct. There could be trauma, but before trauma, let's talk about something that is more obvious, like maybe the constitution.
Production.
Somebody said your abnormal sperm production, low sperm count. You're correct. Somebody made mention of Klinefelter syndrome the other time. Dr. Tolu.
Yeah.
Klinefelter syndrome is actually one major causes of infertility also. You know, they used to have this testicular atrophy.
Yes.
So how do you want to ask Klinefelter syndrome? You want to ask the woman to describe the husband. Is he tall? How has his testes? Is his testes small? Does he have breast? Does he have hair on his chest or something? You want to know. You want to rule it out. You understand? So that is Klinefelter syndrome. So apart from Klinefelter syndrome, what other things again? I don't need to write how you are going to do it. Another thing is TB. TB could actually causes infertility. You understand? So you want to ask the patient, have the person been diagnosed of TB before? Okay. And apart from that also, another thing is what? Mumps. There's something they call mumps-otitis. Doctors, you all remember, right?
Yes, of course.
Mumps will actually cause infertility also. So you want to rule out mumps. Do you understand what I'm saying? So apart from this, what other causes again? When there's problem.
Infection.
Infection, thank you. Yeah, infection. Thank you, doctor. Infection could also be a cause. Infection like STIs. Do you understand?
Yes.
People are having gonorrhea. STIs. Gonorrhea, mumps, otitis, all those things. All those mumps, otitis, and everything. Oh, come on. Otitis. You understand? They are under infection also. Okay? So apart from that, what other thing is when the person or when the man have problem maintaining erection. So when they have erectile dysfunction, and there are so many causes for erectile dysfunction. What are the causes of erectile dysfunction? When the person have problem maintaining erection. And doctor, let me hear from us.
Surgery.
Okay, previous surgery. Apart from surgery, you have to ask, how do you ask erectile dysfunction, please? How do you even ask? You can't just say erectile dysfunction. How do you want to ask the woman? And doctor, Dr. Aisha, you have idea how to ask the man? And doctor,
No.
Eh? Is Dr. Gift with us? How do you want to ask the man? Yeah, how do you want to ask the man about erectile dysfunction? Okay, it's very easy, doctor. You ask, is your husband having difficulties in maintaining erection? That is enough. You have to, like, you understand? Is your husband having difficulty in maintaining erection? That's enough if you are clerking for this thing. Okay. And apart from that, what other causes of infertility? What other causes apart from erectile dysfunction? Drugs.